progressing through our discussion of circulatory disturbances. We're here now with this one, which is hemorrhage. Okay. And here's a nice table that gives you some causes of hemorrhage. Everything from trauma to vitamin deficiencies, such as vitamin K, which is part of the clotting cascade. So those sorts of things. You can read those. Now, how do we classify hemorrhage? We classify it based on its size. And the smallest one is called petechia, and that's the pinpoint type of hemorrhage. And this one is in here because this is the best one I could get to show both of them in the same thing, which is a pinpoint one, and the larger one, which is an ecchymosis. Petechia are like these, what the lines are pointing to here, the really, really small dots, and over there. And ecchymoses are the larger ones like this, more of a splotchy kind of thing. So that's what the difference is. Now here's a nice color picture of a pig kidney. This is from a pig that has classical swine fever. Anybody know what the old name for that is? Hog cholera. But anyway, this is called a turkey egg kidney. This is called a turkey egg kidney. And what are these? Turkey eggs. I decided to put that in there last year because every time I say turkey egg kidney, half the class is, what is that? But you never actually seen a turkey egg. So turkey eggs that do have to have little dots on the surface that resemble this. That's why they call it that. And these are ecchymoses, which are bigger. You can tell these. And this is in the brain. What species is this? Cat. Okay. And the liver. So and here's another one. This is called suffusion, which is much bigger than the ecchymoses. And what's wrong with this dog? What's the general condition that's wrong with it?
General dilatation volvulus.
The what now?
Gastric dilation volvulus.
Gastro.
Dilatation volvulus.
Yeah, I guess y'all got the idea. This is gastric volvulus, and this is a German Shepherd that it actually occurred in. That's the hemorrhage. This is the abomasum, and then numerous hemorrhages here. And these are actually due to ulcers that were present, ulcerations. Hemorrhage involving the ovary. There. And hemorrhage in the spleen. There. By the way, what do you think probably caused that? The hemorrhage in the ovary. Well, around it.
Ectopic pregnancy?
The what?
Ectopic pregnancy?
No, it wasn't an ectopic pregnancy.
A rectal exam? A rectal exam?
Mm-hmm. And what did the what was the person doing the rectal exam probably trying to do?
Palpate?
Well, they were palpating, but what obviously they palpating, but what when I show you that cow as an illustration of somatic death and say what's going on, and expect you to say a nice term like somatic death, and you say, I think he did. But anyway, palpation is what they're doing that for anyway. Now, when they do that, they usually checking for pregnancy, and one of the things they will make sure that they look for are cysts, okay, ovarian cysts. And some veterinarians will say, oh, I got a cyst here. That's probably why this cow is not pregnant. So I'm gonna help things out. I'm gonna pop the cyst. And, maybe 2 hours later, I wanna call you and say, hey, doc, you know that cow you checked? She's not doing so hot. Then you go back and the cow is pale as a sheet. Because actually you broke one of the blood vessels there, and that can't happen. And what do we call it when we do something, when we call something? Iatrogenic, okay? Here's a hemothorax. There's the rib cage. There's the blood. Here's the lung. And again, to show you what it looks like radiographically, and that's all of this kind of shady looking stuff, well, not shady, but that cloudy looking stuff in here. That's the hemorrhage that's present. And here is what it would look like actually if you open the chest. There's the blood. And hemoperitoneum. That's it. And that's it. Actually, there's not, this is hemoperitoneum from this dog, but that's actually not from a dog. That's actually from a horse. But anyway, that's the blood in the peritoneal cavity. Yeah.
Is that, did the dog,
Mm-hmm.
so I'm seeing that there's skeletons there. Did the pregnancy have anything to do with it? There's like little
Nope.
skulls in there, right?
Actually, they're not skeletons. That's just the end of the ribs. Here. This is what you're talking about?
No, I see what she's talking about. It looks pregnant. Do you see that? All these, what looks like skulls?
I don't know. I don't really see it.
Yeah. That's not from
I just wanted to know if there was a correlation.
Wait, yes, there is. It is pregnant.
Yeah, we just wasn't seeing it right.
Wow. You see it, Shannon? You see the spine? Here's one spine. Here's another one. Here's another one.
Well, that's a good thing. What she did was she went online and looked for this picture.
No, I didn't.
Oh, you did?
I still did.
Is it in
Because
there?
I thought it looked like rubber bands or something, and then I saw that there were the spines.
Yeah.
Okay, so she's pregnant with a belly full of blood.
That's still not going to do very well on this, but I guess on your individual computer screen it is showing a lot there. Because when she showed it to me, I can see them on hers, but I can't really pick them out on here. And I don't know if that's the same dog or not. It may not be. Because this one really is supposed to be hemoperitoneum. So, I don't know. Anyway, here's the hemorrhage in a horse, just to show you what hemorrhage actually looks like in the peritoneal cavity. And this is hemopericardium, and that's what the heart looks like before you open the pericardial sac, and when you open it, there's a blood clot around the heart. Now, when you have this kind of situation, it's very likely to be fatal, which this one was. What is actually the cause of this dog dying? What happened?
Pressure on the heart, it couldn't pump.
Pressure on his heart. Yeah, but does that mean it can't pump?
Struggle.
Not efficiently?
Not efficiently. Keep going. You still haven't told me the answer.
It blocks,
All of that's part of it, but you still haven't told me the answer.
It blocks the filling of the atrium.
Say that louder.
It blocks the filling of the atrium.
Yeah. Why is that the case? Because the atria are under low pressure, they're under venous pressure. It's not high like it is in the systemic circulation. And when you put something inside that confined space, the pressure in there actually exceeds atrial pressure. So the atria can't fill. Now, if the atria are not filling, does the heart pump efficiently? No. She's right about that, but she didn't tell me the whole reason behind what's going on, okay? So that's what happens here. Now, it's possible that the heart may not actually be able to contract if you have something in the pericardial sac. And usually what happens there is that you have an exudate that organizes. In other words, you get fibrous connective tissue. And what that will do is hold the heart walls out so that they really can't contract. That's the kind of stuff you can see in hardware. Everybody know what hardware is? So that's the kind of stuff that can happen with that. And hemorrhage in the brain, of course, you know that's going to be fatal most of the time. So, what is the significance of hemorrhage?
Where does it come from?
First, location. If it's in a very vital spot, it doesn't take a whole lot of it to kill you, okay? Location, how long, okay? If you bleed a substantial amount, but very slowly over time, can you compensate for that? Yeah, you can. So how much, how long, and where? Those are the three things that you got to keep in mind. How much was it? How long did it take for that amount to leave? And where is it actually located? This is from a human. Anybody know what part of the brain that is? That's the cerebellum. And the brainstem is right under the cerebellum, and that's got hemorrhage. Why is that so fatal?
Because it's where all of our.
That's because that's where all of our what? That's where
Static memories?
vasomotor center, respiratory center, all of that is in the medulla, right underneath the cerebellum. Okay? And that's got a name for all of those structures. What's it called? The reticular formation? You remember that? No, you don't remember that. But anyway, that's what it's called. Reticular formation. That's where the vasomotor center is and where the respiratory center is. And if you can't breathe and you can't efficiently operate your vessels, what's going to happen? You're going to die. So that's what happens. And what does it look like with the scan? There it is. That's hemorrhage in the brain. And here's hemorrhage. That's actually from a human. This is from an animal. And you can see the blood in the ventricles. How would I know I had blood in the ventricles?
Have you
Diet?
had blood? Is there staining?
You can get an idea from looking at CT scans or from doing an MRI. And that's probably the least invasive way to do it. But there's another way to tell too.
Spinal tap?
Spinal tap, yeah. If you do a spinal tap, you can tell. Because the only way the blood's going to get, well, you can get blood in the syringe when you do a spinal tap if you do what?
Hit a vessel?
Hit a vessel going in. But if you do it correctly, then you shouldn't do that. And the only way you get blood in there is actually if blood is in the ventricular system. Okay. Oh, by the way, too, when you do a spinal tap and you put the needle in, should you rapidly withdraw stuff from it?
No.
Why not?
You can suck out the cord.
She said, because you can suck out the cord.
Not
Well,
the whole cord, just the intracranial.
well, kind of that's right. What the situation is if there is increased intracranial pressure and you rapidly relieve the pressure, look at it like this. If you blow up a balloon, okay, and then you turn it loose, what happens? So that's what happens if you have a lot of built up intracranial pressure, you suddenly release it. That causes stuff to move in the central nervous system. And what is the central nervous system? Brain and spinal cord. Now, what's the problem with that? It's encased in bone. It's got some holes in it where it can back up. And where's one big one? Where's one big one? Foramen magnum. And if the foramen magnum goes back, if the brain goes back to the foramen magnum, that's what you get. A couple of things happen. First of all, is the pressure itself, and then the other thing is the blood vessels that are going into that area get pulled out. So you get hemorrhage as a result of that. Now, this is actually, as I said, from a human, and this one is actually from an animal. That's a horse, I think. And this is what you can see as well. This is called cerebellar coning. In other words, as the cerebellum goes back against the foramen magnum, the wall of the opening itself, the rim of the foramen magnum, it will actually cause an indentation in the cerebellum. That's what it looks like in a human, and that's what it looks like in a cow. I think that's what this is. So, what this is referred to is cerebellar coning, because this makes this kind of cone shape instead of being a nice round shape that it would normally be. It has this look like an ice cream cone. So that's why they call it cerebellar coning. Now, what will cause increased intracranial pressure other than hemorrhage? The uplifters. So that's something that can cause increased intracranial pressure as well.
Question.
Yeah.
Dr. Graham, what species was that one? What
That was a cow.
A cow?
Yeah.
Okay.
So what would it look like in a dog? So would this really look any different in a dog than it looks like in this cow?
No.
No, not a bit. Okay, here's a case. A horse. And this is a 6-year-old quarter horse, gelding. And lethargy is the complaint. Weakness, rapid respiration, all that, you know. And when you look at it, you see all this stuff. By the way, do you know what all these terms mean?
Yes.
What does this mean? Epistaxis, what's that? Bleeding from the nose. What's this? Bleeding from the urine, bleeding in the urine. Hematemesis? Is what? Is what? Vomiting blood? Yeah, it's coming up through the GI tract, from the GI tract. Okay, and what about prolonged capillary refill? That says that the circulation is not efficient. Okay, and multiple foci of petechial hemorrhages and ecchymosis. And that's showing you this kind of stuff here on the lip, on the sclera. Which one is this? That's the epistaxis, okay? And on the muscle, our nose. Okay, let's look at what we got here. So with our blood, what's this telling us? Stress. Finally, you guys figure this stuff out. Okay. What about this? Let's do a solid side. Fibrinogen. Okay. And cows are the ones that react with this a lot sooner than dogs and cats. Horses come up there too, but they're not quite as rapid with that as a horse or a cow. So in both horses and cattle, it's an acute phase reactive protein that you see, and it indicates that you do have some injury, vascular injury somewhere. Okay, what about the PCD? And over here, what have you got anything over here that says anything? Not really. Now platelets are down. Well, that's something you got to be careful about. How long do platelets last? Then I take a blood sample. I'm going to analyze it for platelets. How quickly do I have to do that? Fairly quickly, within about 30 minutes or so, because they start to deteriorate after that. So when you see a low platelet number, that could indicate that. But when they're this low, you probably are actually losing something. Or using them up, and put it that way. Okay. Looking at our chemistries, total protein is high again, albumin is low, and what is that telling us? Probably, what? Dehydration? Yeah, okay. And we may have some breakdown of muscle and other tissues as well. CK, AST, ALT, maybe some problems in the liver, especially if we got enough hypoxia from the bleeding. Okay. And this is the culprit. Gram-positive chains and venous hemolysis. So what's wrong? Now some of you know what's going on, so the strangles, and the others say streptococci. For those of you that just had microbiology and you haven't really been around horses and that kind of stuff, you probably wouldn't know the term strangles. But it is a streptococcal infection.